Come in.
Hello, my name is Shan, and I'm going to be the nurse taking care of you. How are you today?
A little short of breath.
Okay.
A little short of breath.
My hands here first before I...
Thank you.
Okay. I'm going to be doing a head-to-toe assessment today. Is that okay with you?
Mm-hmm. That's
Okay.
why I'm here.
Okay. Before we get started, I'd like for you to verify your name and date of birth.
Kelly Sunshine, and my birthday is 3/31/1952.
Okay. And do you know where you're at today?
I'm at the cardiology clinic.
Okay. And can you tell me what I'm going to be doing to you today?
You're checking me out.
Okay.
Thank you.
And
it's my annual appointment.
Okay. And do you know who the president of the United States is?
Yes, God, yes, Donald Trump.
I had the nurse's aide take your vital signs, and let me just
lovely person.
Let me just review that with you. Your temp today is 98.7. Your blood pressure is 187/78, and your pulse, heart rate is 102. Is that normal for you?
Well, the heart rate, yes. The blood pressure is a little higher than usual. Maybe just because I'm nervous about seeing a new provider.
Did you take your medication this morning?
I did.
Okay. And your breathing is a little bit on the high side.
Yes.
It's 26 right now. And we did take your oxygen level, and it's 88%.
Oh, my goodness. I need some oxygen.
Do you normally use oxygen at home?
I do.
And is there any reason why you didn't bring oxygen?
I really don't like to bring it out with me. It's kind of embarrassing.
Okay. Well, we'll see if we can get you on some oxygen, okay? And how many liters are you normally on at home?
Just one.
Okay.
At night, sometimes two.
Okay. And do you have any pain right now?
No.
Let me have the aide get your weight, your height, and we'll calculate your BMI.
All right.
Okay, and that's your body mass index.
Oh, yes, come in.
So I am back. I'm going to be doing your assessment right now. I'm going to clean my hands. And first of all, on general exam, we're going to check her overall status. We're going to check to see if she's calm, if she's agitated, if she responds well to appropriately to questions, if she's anxious. We're going to check to see if she's tired. Of course, right now she's short of breath, so we did get some oxygen put on her. And she did state her age and her skin color. She's a little bit on the pale side. And are you able to hear well?
Mm-hmm.
Okay. And she has no delays. She has no amputations, and she's wearing glasses. So just her overall appearance, she's not cyanotic, and she's got good posture and good hygiene. She has no smell. Obviously, she's not a smoker. Are you a smoker?
No.
Okay.
I used to smoke.
How long ago did you quit?
I smoked for about a year when I was like 16.
Oh, okay. So you're not smoking anymore?
No, God,
okay.
Not for years.
That's good.
But I think it hurt me.
Now I will be assessing Miss Sunshine's psychological wellness. So in the last 2 weeks, have you felt sad?
Maybe, I guess, but nothing I can really remember. But some things make me sad. Sometimes TV shows make me sad.
Okay.
Or books.
Not, nothing's made you unmotivated to do
no.
anything? No. Have you felt depressed in the last 2 weeks?
No.
No? Okay, good. Have you had any thoughts of hurting somebody or hurting yourself?
No. I have never had a thought of hurting myself.
Okay. Do you have friends that you hang out with?
Well, since all this COVID-19 stuff, I really don't hang out with anybody. But I talk to people on the phone.
Good.
Talk to my children on the phone. And I got my pets.
And how many children do you have?
2.
Do you you have good transportation to get you?
Oh
back
yeah,
and forth to
I
your
love my car.
appointment? Okay, and so you're still able to
Mhm.
drive. Great. And have you ever engaged in any illicit drug use?
No,
Um, do you drink alcohol?
I sometimes drink alcohol.
How often? Or
I
maybe
I
when
can't even answer that actually. I don't not even for sure once a month. I guess like
that was
I don't
your
know.
last drink?
I can't honestly remember.
What did you do before you got sick?
You mean at my job
Yes,
or
yeah.
hobbies?
Yes.
I was a second grade teacher.
Do you go to church?
No, I used to go to church actually. I used to go to church almost every Sunday.
And do you pray often?
I pray daily.
Or what is your religious preference?
I guess I guess Christianity, and I like getting Holy Communion, and I pray.
Okay. And do you meditate?
I do meditate. I meditate, yes.
Oh, good. Good. Okay. So right now I'm going to take a look at her hair and check to see if she has any baldness, if she has any infestations, any of that right now. So I'm going to look at her hair. It's gray. And then I'm going to take a look at her face. Okay. I don't have a pen light, but can you take a look at me real quick, and then can you just follow with your eyes? Okay. And then I'm going to go ahead and take a look at your ear, okay? And you want to take a look at the ear, palpate the back of her ear, and then we'll take a look at her, the inside of her ear. Have you had any infections in your ear?
Not for a while.
Okay. No trauma to your ear?
No.
Okay. It doesn't look like you have any infection going on right now. Okay, take a look at me. Can you smile? Can you frown? Can you blow? And can you, oh, good, good, good. Okay, so go ahead and open your mouth. I'm just taking a look to see if you have any good, you have good color on your tongue. Okay, so those were checking for her cranial nerve to see if they were intact, and her eyes are symmetrical. There was no redness, there's no jaundice, there's no drainage. She can close her eyes, there's no drooping. Her ears are normal shape. Her nose, can I just take a look at your nose real quick? Okay, and you can go close one side, and then close the other side. Good.
Allergies.
Yes.
This smoke in the air is a bummer.
Okay, so she can smell and she can breathe well, because that's what we're going to need for her oxygen. And her ears, there's no lesions, no masses. I palpated her mastoid process, and the tympanic membrane is gray, no bulges, it's intact, there's no holes, and looks pretty normal. Okay, so I just got back your information on your weight and your height. Your weight is 179 pounds today, and your height is 5'3", and we calculated, and your BMI is 38. So that means that we're gonna have to try to get you walking and
Terrible news.
start some sort of exercise. Okay,
Yes.
but back to your throat. I'm just checking to see if her lips are blue. We did put some oxygen on her. Her respirations are now around 20-ish, And I'm going to check her trachea line to make sure they're center, midline, and I'm just going to check. Okay. And then I'm going to check her neck to see if she has any JVD, which is classic signs for heart failure, and it's usually a bulging artery on the side here. There's nothing there. I'm going to take a listen to her carotids and listen for a brewery.
Sound okay?
Yes, and you never do both of the carotids at the same time. You can only do them one at a time. Good. Okay, good. So now we'll take a look at her heart. Um, we're going to inspect for lesions. We're going to inspect the skin around the heart area. We're going to check for swelling. We're going to check for redness. We're going to check for any infections or rash or any sort of that stuff. So if they have an IV or central line in their jugular vein, then this is when you inspect to see any redness, swelling, drainage, if the dressing needs to be changed, flush it, aspirate it to make sure it's flushing good. And so what right now we're just going to check the palpation of the wrist on both sides, the peripheral pulses. And then we're going to check her capillary refill, and that's done by pushing down on the finger, and it should be less than 3 seconds, and it is less than 3 seconds. Let me do this side. That just means she has good circulation. And we are going to check for skin turgor. So you put a little tinting up in her skin, and that just checks for hydration on both sides. Good. And we're going to check for range of motion. So we're going to put her arm up and then put it out and put it all the way up and then up in front of you and then down to the side. Okay, so that was done good. So up to the side. No pain at all? Okay, I'm just checking to see. So now I'm going to listen to her heart, and we are going to listen. Okay, so right now I'm going to take a listen to her heart, and I'm going to listen in the aortic, the pulmonic, the herbs, the tricuspid, the mitral, and then the side here. And then we're going to put her arm up. Okay. So to listen to her heart, she does not have any heart murmurs or any abnormal sounds in her heart. I'm first going to listen to her atrial and compare it to her her peripheral pulses. And normally the heart rate should be anywhere from 60 to 100. Okay, I didn't hear any swishing. I didn't hear any murmurs. I didn't hear any. Her heartbeat is about 67 beats per minute, and it did come down from her 120 at the start of our assessment. Okay, and were there any pain in your fingers?
No.
No pain in your fingers. And let me take a feel of your AC pulses real quick. Okay, good. And so, because I'm a dialysis nurse, a lot of times there's AV fistulas in the bottom of her arm or the top, either on either side. And what you would want to do in that case is take a listen to it to see if you hear a bruit or if you can feel a thrill, and that just indicates that it is working well. So you just over the site wherever the dialysis access is. It could be here or it could be here, just to make sure it's working well. And then we're going to go ahead and test for strength now. So what I want you to do is squeeze my finger, okay, and then push down. I'm going to pull up, okay, and then push down push up while I push down. Okay, good. And then pull towards you, and then push towards me, okay. And so I also need for you to stand up and put your arm straight like that, okay? And normally, if a patient has had a stroke, one side of the person's arm will either go up or down like that, and that's called drifting, and she doesn't have that right now, so thank you. Have a seat. And we're just going to check for digital clubbing. I'm going to take a look at her fingers, and normally for digital clubbing, it just indicates that the patient has, it's a classic sign of heart failure as well. It indicates that there's fluid on board. At this time, we're going to take a look at her breathing. Her breathing did come down. She is now breathing at about 20 breaths per minute. And so I'm going to take a look at her, take a listen to her lungs, and her efforts of breathing has calmed down a lot, and she's not as anxious as she was when she first came in, and she's not in any type of labored breathing, and and I'm going to check for her barrel chest. That means usually patients with barrel chests, people that have COPD, have a big barrel chest, and she doesn't have that. So looking from here, from this angle. At this time, I'll take a listen to her anterior and her posterior lung sounds. I will start on the apex of her deep breath. Okay, so the right side has 3 lobes and the left side has 2 lobes. Okay, I'm going to start in the back. Deep breath. And do some percussion here to see if there's any fluid. Okay, there's no fluid so far. I didn't hear any crackles. Normally, um, patients that have a lot of fluid on have heart failure. You could hear crackles or wheezing. In this case, she doesn't have any wheezing. She doesn't have any crackles in her lower lungs. Okay, so um, I checked to see if she had any pleural friction rubs, stridor. Are you taking any? Are you taking your water pill?
Oh, every morning. Yes. If I don't take that, I have big trouble.
Okay. So when was your last dose?
This morning.
This morning. Good. Mm-hmm. Okay. And so right now I'm going to take a look at her stomach. I'm going to ask her if she has any stomach issues. Do you have any stomach issues? Mm-hmm. When was your last bowel movement?
This morning.
And what did it look like?
It was brown and formed like a banana.
Okay, and how's your appetite?
Oh, my BMI's 38, girl. I have a good appetite.
Okay, and did you have breakfast this morning?
Yes, okay. Cheerios.
Okay.
With blueberries.
Have you had any nausea, vomiting, diarrhea?
No.
Okay. And so I'm going to take a look at your stomach. I'm supposed to listen to it first. So this is the only part of the assessment that you listen first before you start palpating. And I'm going to go from right to left. Okay. Your stomach sounds are on point. Usually stomach sounds should be anywhere from 5 to 30 per minute. And if at any time you don't hear anything, then you would have to listen to the stomach for a full 5 minutes. Okay, and so right now I'm going to palpate and check to see, have you had any, are there any scars?
No.
You don't have any scars here? And have you had any children?
Yes.
How many?
2.
Okay, and I don't feel any, and there's no pain in your stomach? No. Okay. And no lumps. I don't feel no lumps, and I don't feel no hardness, and Are you? Of course, you're on Lasix, or is that what you're on? Is that your the water pill?
Furosemide.
Okay. So, are you urinating okay?
A lot.
Okay. And are you having any trouble using the bathroom at night? Do you
I have
constantly get
no
up?
trouble using the bathroom at night or any other time during the day.
Okay. So, do you have any? Have you noticed any discharge?
No.
Okay. And do you still get your menses,
No.
or are you menopausal?
Yes.
Okay.
When I was 50, I stopped having my period.
Okay. And then, so if she was in the hospital, we would check her Foley if she had a Foley, and we would inspect it. We would check the drainage. We would check the amount, the color, and would DC it after 48 hours. And so now I'm going to inspect her musculoskeletal system, and I'm going to start with the legs and check to see if there's any hair. And she does have 1+ pitting edema, and because she's on Lasix, that should be helping her keep the fluid from building up in her legs. So I'm going to also check her capillary refill in her toes. I'm going to check to see if she has any fungal, or older people have a lot of fungal infections in their toes, and she does not have any fungal infection in her toes at this time, and her skin is normal in color, and it's intact. There's no bruising. There's no there's a little bit of scarring. So I'm checking her leg to see if there's any discoloration. Usually discoloration indicates either bruising or peripheral vascular disease, arterial insufficiency, and just inspection of her foot. She does not have any gout.
Thank you, Lord.
And and then so let me hold up your feet, and let me get this thing here. So I'm going to check her reflexes, and okay, so if you run something like this and her feet go in like that, that's checking the Babinski reflex. So it'll go like that. See, there you go. Okay, good job. If it were to fan out, then that would mean that she has neurological damage. She has all 5 toes. There's no amputations and no prior surgeries, and her skin is intact. And just the only thing we are concerned with right now is her edema, and that's from her history of heart failure. So
it's pretty good right now.
Yes, it's pretty good. Well, thank you, Miss Sunshine. It's been a pleasure to take care of you, and I will be back.
All right, then. Thank you.